A year ago, a young single girl in her 20s met me at a clinic. She was interested in starting the 3-monthly form of contraceptive to prevent pregnancy and was going to have sex in a couple of days. Well, after having a 15-minute counseling with her, her choice of contraceptive changed. So before taking the next pill or injection or even using the next condom, there are about a dozen of factors that you should take into consideration in choosing a contraceptive that is best for you. So please stay with me to the end of this episode so you don't put yourself at risk because of an orgasm. Happy New Month to you guys and welcome to my channel. This is Triple F with Dr. Obels, and please, if you actually learned something from my videos, do not forget to subscribe and also turn on your notifications so every Friday at 8 p.m. you can be reminded whenever I put up a new episode. Content in this episode is rated 18. Viewer's discretion is highly advised. I won't be beating around the bush today. Do you want to keep having sex but you're not ready to have a baby? If your answer to this question is yes, then it's time for you to consider using a form of contraceptive, because this is not only cheaper but it's also safer for you. If you want to know what life feels like after an abortion, please listen to my previous episode of life before, during, and after an abortion. Before you decide what is best for you and your partner, let's take a look at the 7 different classes of contemporary contraceptives that is available. 1. Barrier methods. They prevent sperm from getting to the egg to cause fertilization, either physically or chemically. Examples include male condom, which is usually worn on an erect penis, female condom, which is inserted into the vagina before sex, diaphragm, sponge, and cervical cap, which is usually inserted into the vagina to cover the cervix and prevent sperm from getting in. Spermicidal creams, jellies, films, suppository that contain chemical that inactivate the sperm in the vagina before it ascends into the upper genital tract. 2. Medications. They inhibit ovulation, prevent fertilization, and thicken the cervical mucus. They come in the form of combined oral contraceptive pills, which are made up of progesterone and estrogen and is taken every day. Progesterone-only pills, which is also known as a mini pill and is taken daily. And high dose of progesterone, which is used as an emergency contraception. 3. Injections. It may be combined having estrogen and progesterone in a 1-monthly formulation, or it may have just progesterone in a 2 or 3 monthly formulation. 4. Other hormonal delivery system. As the name implies, it's a system that gradually releases hormones into your bloodstream. It may be in the form of a vaginal ring that is 1 monthly, or a transdermal patch that is placed on your buttocks or abdomen or upper outer arm or upper part of your torso, excluding your breast, and it's usually placed once weekly for 3 weeks. 5. Implants, which act by inhibiting ovulation and is inserted under the skin of your upper inner arm. It is progesterone only and lasts for 3 to 5 years. 6. Intrauterine devices known as IUDs, which act by preventing fertilization and is usually inserted into the womb. It can last for 5 to 10 years. It comes in 2 forms, copper-based or progesterone-based. 7. Sterilization methods, which are relatively permanent methods. Tubal sterilization for women, which involves blockage of the fallopian tubes to prevent fertilization of the egg, or vasectomy for men to prevent the transportation of the sperm. To decide which is best for you and your partner, you have to consider a dozen of factors, as all forms are not suitable for everyone. Accessibility. How easy is it for you to procure your desired form of contraception? Surgeries require skilled doctors. Insertion of IUDs and implants requires a skilled health professional, while you can get condoms and pills over the counter. Costs. In some centers, condoms, pills, IUDs, and implants are given at a subsidized rate or even free of charge, just in case you cannot afford your contraceptive of choice. Your partner's STD status. If you're unsure if your partner is clean, that is, if he is STD free, then the best form of contraception to use is a condom, as this is the only form of contraception that prevents the transmission of STDs. How soon do you want the contraception? If you just had an unprotected sex, then Postinor 1 or 2, a high dose of combined oral contraceptive or copper IUD is immediately taken or inserted after sex. However, the side effects of Postinor, including headaches, breast tenderness, dizziness, nausea, vomiting, abdominal cramps, irregular periods, may limit its use. They are also recommended for rape victims and in cases of condom breakage or slippage, and are hence referred to as emergency contraceptives. Ability to comply with use and convenience. To be effective, condom has to be worn every time during sex. You must take your pills every day. You must remember to renew your 2 to 3 monthly injections as at when due. Your 3 to 5 year IUDs must be renewed whenever it expires, and the surgery is usually done once and for all. So make your choice. Are you presently on any medication? If you are on anti-TB, ARV, medications for migraine, anti-epileptic or diabetic medications, please avoid using combined oral contraceptives and do well to discuss your form of contraceptive choice with your healthcare provider. This is because some medications interact with each other and reduce efficacy. Are you breastfeeding? Then you can use a progesterone-only pill, injections, or IUD. Estrogen-based contraceptives have been shown to reduce milk volume. Desire for a permanent method. If you have no desire for children anymore or you have completed your family size, then you can consider a permanent method. You can use tubal ligation or you can suggest vasectomy to your partner. Presence of ongoing illness. Avoid hormonal contraceptive if you have a serious liver disease or a previous or present blood clot in your leg, lungs, or brain. Women who have diabetes, high blood pressure, heart, kidney, and gallbladder disease should avoid combined oral contraceptives until you have discussed it with your doctor. Recurrent PID or STD. If you are prone to having recurrent infections, then it is best for you to avoid every form of IUDs, as this will only worsen the condition. Presence of breast or cervical cancer. If you have any form of these, then it will be best for you to avoid any form of hormonal contraceptives ranging from pills, injections, IUDs, or implants. Side effects. Some women may have vaginal irritations using spermicides. Some men may react to latex or polyurethane condoms. Candidiasis is common in women using diaphragm. Some women experience irregular bleeding using progesterone-only based pills and injections. Weight gain may be experienced in few sensitive women that use combined oral contraceptives. You may have an increased risk of ectopic pregnancy and PID using IUDs. Increased menstrual bleeding and pain using copper IUD, and there may be complications during surgery. Ensure to discuss with your healthcare provider the possible side effects of your contraceptive of choice. It must be noted that no form of contraception is 100% effective, and this is dependent on how and who takes it, uses it, inserts it, and who performs the surgery. Example, a male condom has a 14% failure rate. Other failure rates of different contraceptives is as shown in the diagram. In situations and conditions where none of these is available or most are contraindicated, some women have used age-long method, which some, I must warn you, have a very high failure rate and also come with its challenges. Ovulation calendar method. This involves calculating and noting your fertile days using your menstrual cycle and staying away from sex during this period or using a condom. It works only if you have a regular menstrual cycle. To know how to calculate your fertile period, please watch my previous video on prevent unwanted pregnancy. Lactational amenorrhea method. This is effective if you exclusively breastfeed your baby for 6 months without adding water or any form of supplement. With this, you won't experience any ovulation during the aforementioned period. Postcoital douching. This involves the woman inserting her finger into her vagina in an attempt to remove the ejaculated semen. As seen in my previous episodes, why your vagina stinks and the vaginal discharge you should worry about, this will only lead to a smelly vagina, bacterial vaginosis, and increase her risk of having pelvic inflammatory disease. Withdrawal method. In this method, the man has to have a strong pull-out game, and pregnancy is very likely considering it also releases pre-ejaculatory fluids, which most times contain the sperm. If the man is a fast comer, please don't try this method. There's no hope at all. She will carry belly. Extravaginal intercourse. Oral and anal sex come with their own risk, and to know more about them, please watch my previous video, the correlationship between blowjobs and STDs and anal sex, healthy or unhealthy. It is important to put the risk of contraceptive use into perspective, because what may work for you may not work for another. Decision of choice should be based not only on the non-contraceptive risk and benefits, but also on the efficacy of the method. If all these forms of contraceptives fail and you eventually become pregnant, please do well to watch my video, The Newly Pregnant, to know what you may expect during pregnancy. Life as we know it is all about risk, but make sure that the risk taken is well calculated. Please share this with all your sexually active friends, for you never know whose life you might just be saving. Remember to subscribe to my channel, please. And I will see you same time next week, Friday. This mosquito will kill you. Please. I killed you. I killed it. I killed it. Look at that. Look at that. Can you see that? Can you see that? Can you